everyone. This is Esra Baykal. It's great to be here with you in Arab Health Week. And today I will be talking about the digitalization of well-being and mental health and how we can use technology in order to fill the gaps within the mental health industry. So before I will jump to the topic, I would like to just introduce myself. I am the CEO and co-founder of Moodcare, mental well-being and self-therapy app. Moodcare is a mindfulness-based cognitive behavioral mental self-help tool that is supporting the mild depression and anxiety problems. So let's begin. So I would like to firstly start with why the digital mental health care is important now. So before the pandemic time, when we look at the trends, we already had that individuals were facing with many behavioral mental disorders like depression, anxiety, body image disorders were already in rise. And during the pandemic time, those problems increased in a huge number of ways. They are surged a lot. So according to the McKinsey's data, in United States, individuals reported the symptoms of anxiety and depression 3 times more than pre-pandemic levels. And another very concerning data is that individuals reporting the suicidal ideations increased 2.8 times more, and as of May 2021. So it's such a recent data. And when we look at the annual drug overdose deaths, as of October 2020, those data increased like 30%. And in general, the number of individuals that need behavioral health support increased like 50%. So we see a huge surge on the demand from the individual side that they are in need of different mental health support. However, data also shows that the total claims for behavioral health services in 2020 comparing to 2019 declined 8%. So this shows that even though the need is there, the current services, we cannot utilize the current services effectively. Of course, there are different factors why this is happening. Cost is one of them, the shortage of therapists, and also the public stigma are, couple of factors that are limiting the access of mental health care. And I would like to talk a little bit about from different angles, like consumers and institutions, how are they approaching to this situation? So from the consumer side, what we see is that the adoption of the digital services on the traditional treatments are increasing, such as telehealth. People are getting used to the idea of meeting with their therapist or the psychiatrist on the online channels. Another thing that we also see that the stigma on mental health is in decline. So people start to accept the conditions, start to share these and talk about that within their network. So we start to overcome the stigma on mental health, which is a good thing. And the demanding consumers are also demanding better employee mental health coverage from their employees. And I would like to also look from the institution side how they are approaching to this situation. And I would like to give example from the United Arab Emirates. The Ministry of Health and Prevention, MOHAP, initiated the new telemental health and also psychiatric emergency services at the very beginning of the pandemic in 2020. So United Arab Emirates is one of the early adopters of technology on the healthcare ecosystem in UAE. And also we see that employee well-being programs are launched, the different kind of toolkits were spread to the employees. And when we look at from the technology enabler side, we see some movements from Apple and Google. Apple just announced a couple of weeks ago that in the Worldwide Developer Conference is that in iOS 15, the new features that are connected to mental health will be launched. Those are like focus features, securing the healthcare data sharing features, and also new healthcare insights and different kind of reportings. And from the Google side, Google, partnered with the National Alliance of Mental Health, Mental Illness, in order to provide scientifically backed and reliable resources for the users who are having, depression and anxiety problems, such as scoring, like depression scoring, anxiety scoring, and how the industry is responding to this change. As I mentioned earlier, that currently the traditional methods are not utilized with its full effectively. We don't utilize them, and different kind of approaches are trying to fill the gap in the industry. One thing is telehealth. We see that the telehealth is growing all over the world. Like patients see doctors, therapists online, on demand. One very good example is from Ginger in United States. And the self-therapy tools are also emerging, like the people who don't want to get just counseling from someone else can have those self-help tools and try to overcome the mild disorders by themselves. One example is our company Moodcare. We use evidence-based therapeutic interventions so that users can use their own convenience to tackle with those problems. Third thing is the digital therapeutics. The prescription of health apps that are targeting the specific disorders are emerging, and Germany and United States are pioneers. Just a couple of months back, Germany launched that those mental health apps can be prescribed as a medicine, and Deprexis is one of the example of that segment. And also we have well-being tools like mindfulness, sleep, and meditation apps like Calm, which had a little bit longer, older history. And I was talking about employee well-being. It became more and more important. According to the McKinsey survey, 23% of people in the workplace have depression. And out of this, 23% of people are losing their productive times 5 times more than other employees. So it's a huge number. And also they are missing the work 2 times more. So employee well-being is not about only, it's not only the right thing to do, but it is also having a business outcome. Better support brings better business and more effective outcomes on the business. And we have different perspectives from employee side and the CEO side. According to Ginger search, we see that 96% of the CEOs think that they are doing enough for their employees' mental well-being. However, from the employee side, they only agree like 69%. And I would like to talk a little bit about Moodcare, like how are we addressing this mental health problem in the world. Moodcare is a mindfulness-based cognitive therapy app that is helping users to manage mild depression, anxiety, and other behavioral conditions. It is developed by psychologists, and we are utilizing artificial intelligence and science-backed cognitive behavioral therapy techniques. In the fourth screen, as you can see here, we have a chatbot that users can engage with this chatbot about the emotional situations. And based on the emotional stage, Moodcare is suggesting different kind of CBT tools, CBT activities, so that people can practice on their own. And we have behavioral educational programs and regular mental health reports in order to show to our users that they can see their progress within their own data. And we have a freemium business model. We have free and premium versions. During pandemic time, we decided to become very generous about our free version. We have the AI-driven chatbot, mindfulness exercises, behavioral educational programs, reports and insights, and a couple of different CBT tools in order to help people to manage the mental problems and mental disorders. And in the premium version, users can access to services in a full service. So that's all from my end. I'm happy to get connected about and discuss more about the situation. Let's overcome together this problem and just fix it. Please feel free to get connected with me through LinkedIn and via my email. Thank you.